Last year, Dr. Rafi Landowitz and Dr. Malcolm John were recognized by the American Academy of HIV Medicine for their advancements in HIV care through innovative technology. This year, the American Academy of HIV Medicine and the Institute for Technology in Healthcare have teamed up again to bring you the second annual AAHIVM Institute for Technology in Healthcare HIV Practice Award. This year's winners, Dr. Nadia Dowshen and Dr. Melissa Badowski, each will receive a $10,000 grant to further their award-winning programs. Dr. Badowski has been recognized for her HIV telemedicine clinic for correctional facilities.
The American Academy of HIV Medicine is fundamental in providing awards of this nature because it exposes practice sites that are utilizing technology. Telemedicine is a way to go various distance to provide high-level subspecialty care. And the thing that sets us apart is that we're using a multidisciplinary approach where we have a clinical pharmacist, a physician, and a case manager all working together to improve outcomes in the inpatient or in the correctional facility and as well once they're released, so we can provide a continuity of care for them.
Here at UIC, we use modern video equipment and audio equipment as well as specialized medical exam equipment like stethoscopes that are electronic and high-definition handheld cameras to examine patients.
On an average day, we typically see about 15 patients, whether they're new or follow-up appointments. We've seen as many as 25 patients in a day. The one thing that is unique with our correctional setting is that the patients all show up, whereas in a regular clinic setting on the outside, a lot of HIV patients don't follow up for care.
And in each of the prison infirmaries, there's a little telemedicine suite, and the patient is there with the nurse. And we have basically a live encrypted video chat, so we sort of have a virtual visit. We can see and hear the patient, they can see and hear us, and we can perform focused medical exams, like listening to their heart and lungs.
I'm gonna put my headphones on. Hold on one second. Okay, nice deep breaths, in and out.
We adhere to the guidelines, and we're able to see a lot of patients become virologically suppressed where their viral load is undetectable. It's probably one of the greatest things that I've seen. We've also been able to identify and manage side effects as well as drug interactions that regular providers might not be aware of or thinking that it might be due to the medications. We plan to use the award funds to provide educational endeavors for the nurses that we deal with in each practice facility. We hope to increase their knowledge of HIV. It's increased greatly since we've started, but we have identified some areas we would like to improve upon. Additionally, we would use these funds to travel to different conferences to present our findings and a lot of the technology that we're using.
So this technology could be used anywhere. Really all you need is a high-speed internet connection. It can be used to see anybody with a lack of access to subspecialty care. People like prisoners, people in nursing homes, people in rural emergency departments, really all over.
Dr. Dowshen has been recognized for her mobile application for teens with HIV.
I think this award for technology in HIV practice is a really important one. We have so many opportunities with new technologies that are out there to make a difference for our patients. So I think some of the most compelling and innovative technologies coming down the pike for HIV care are those related to mobile technology. Mobile technology allows us to communicate with our patients in ways that we couldn't before, and it allows us to give them support and feedback in the real times and places. So when taking care of young people living with HIV, one of the things that I've always been struck by is how oftentimes when I'm trying to get through to them, they're too busy on their phones, texting or talking or Facebooking. So the mobile application that we've developed called MedCheck is going to help teens to improve their adherence to their medication, which we know is a major challenge for everyone, but particularly for many youth living with HIV. One of the great things about this application is that it can reinforce positive behavior. So every time a young person indicates through the app that they've taken their medication, they will get some kind of immediate positive feedback. So the plan for the application that makes it different from a lot of other mobile health applications are out there is that we're designing it so that it's going to have a very robust back end, meaning that the provider is going to have access to all of the information for every time that the patient interacts with the application. So I'm really excited about the grant that comes along with the award from AAHIVM because I think it's really going to help to take the application to the next level. So we have something that's working now, but the next step is to really see what you think about it. And I hope that this mobile application will be one of the tools that we can add to what we're already doing for our patients to make it more likely that they'll get on their medication, that they'll stay on their medication, and have success with getting their viral load suppressed.
AAHIVM would like to thank the Institute for Technology and Healthcare for their generous support of this award.